Welcome. My name is John Flett. I'm a paediatrician who is passionate about helping parents and children who have learning problems, who think differently, and in particular ADHD. Have you thought about the fact that your child, even before they were diagnosed and treated for ADHD, have been treating themselves for a long time? Children employ natural treatment of ADHD. If we don't treat children properly for ADHD, they will treat themselves. And I'll help you understand what I mean by treating themselves. ADHD is a problem of lack of dopamine. If you put your hand on your forehead, beneath your forehead is the frontal lobe. And that's the control center. That's the center that keeps everything in check. It releases the chemical dopamine. It helps calm down, helps control the symptoms of ADHD. In essence, it is the braking system of the brain. It is the control, the driver of the brain. And without that control, children are out of control. So in order to get that chemical dopamine, children employ and try natural things to treat themselves. And some of these might seem familiar to you. Over the last week, I've been chatting to parents and they've been telling me about some of the things that children do, and it, I think, really hit home as to what children do to treat their own ADHD. If we don't treat it, they're going to treat it themselves. And how do they do that? One of the things that they do is they employ movement. They are jittering. They're moving. If they don't get attention, they move, get your attention to release that dopamine. They move, they're impulsive, they're talking, they activate themselves. They invite feedback. They want to provoke. They try a game called, how can I annoy my parents in an amazingly different and unique way? They provoke to get a reaction. It releases adrenaline and dopamine, which gives them their kind of, that little hit. It gives them their sort of kind of their fill of dopamine. They get upset. They get emotional. Even thinking about emotional and difficult things and getting themselves worked up is a way to naturally treat themselves. And often you'll find they have meltdowns. They have emotional meltdowns just for no reason. Sometimes thinking very difficult, anxious thoughts and making themselves feel in a place where they feel uncomfortable and anxious is a way of self-medication. And another way, they try sugars. They eat impulsively, getting their dopamine hit. Sugars, getting these highs. The sugar goes up, makes them feel happy, but they feel lethargic and don't worry. Like the song, be happy, don't worry. But it's not ultimately going to help them. Gives them immediate sort of sensation of being happy, but it doesn't really treat their problem. Children with ADHD like to be busy. They like extreme things. They like dangerous things, impulsive things, getting on their bicycle, going down steep hills, trying crazy things, jumping across ditches, jumping out of trees, trying just mad things, spray painting the garage red just because they felt like it, or getting toilet paper and throwing it around the bathroom just for fun. Also, what children try and do as well is by eating sugars, they impulsively eat. Of course, it affects their health. And then you might recognize some of the things that some adults do. Some adults treat themselves literally with retail therapy, impulsive buying lots of things that don't even get taken out of the wrapper. They drive their cars fast. They get thrills out of extreme sports. Children with ADHD like sport. They treat themselves by doing lots of sport activities. Just in the last couple of days, just to try and attract attention. Children, just while they're waiting outside my consultation room, they'll wait for a while. You can hear them in the background making lots of noise, attracting attention with my staff, and then suddenly tapping on the door, wanting reaction. If they don't get attention, they're going to get attention from you. They're going to annoy you. They're going to undermine you. They're going to drive you crazy. So that's why we've got to try and treat ADHD, because then they won't try those extreme things. They won't provoke those emotional meltdowns. And of course, with emotional meltdowns, suddenly if you don't react, you don't feed that reaction, they're going to try harder. It's almost like somebody who has a drug habit. You take their drug away, the cocaine away, and they go into withdrawal. They even try harder to annoy you. ADHD is a condition where that constant need for something new, everything's boring. Ask a child with ADHD about school, it's boring. It's not interesting. They try to make their lives interesting in class by tapping their ruler, playing with the erasers, throwing things, getting up, more moving about, interfering other children's education system. So I thought that would give you a different perspective on how children with ADHD treat themselves. They know the best natural way. Those are the symptoms of ADHD. Often the symptoms are a natural way for children to balance by releasing their own dopamine. By treating, we are supplying the brake fluid on the brain to help calm down that brain so that they don't have to try all those extreme things. They don't have to go outside and annoy and provoke. They're in control. They start to behave the age. ADHD is in essence a self-control problem where the front of the brain, which doesn't have enough dopamine, is immature. They behave like younger children. So I'd encourage you to get help, seek help, and manage your child's ADHD. They won't become addicted. They won't try different things. They won't try those addictive substances later on in life. So I hope that gives you perspective.